Afternoon, and thank you all so much for joining us today. My name is Andrea Dukas. I'm a program officer with the Robert Wood Johnson Foundation, where we work to try and build a culture of health in the United States. We are looking to create communities where everyone, regardless of where they come from and where they live, has the opportunity to live the healthiest life they possibly can. And we know that healthcare systems that are responsive to individuals' goals, needs, and preferences are an essential part of that culture of health vision. But a high quality, high value healthcare system is really only high value and high quality in so much as that it's accessible. And we know that if we're going to ask individuals and consumers to make decisions about where to go for care or the type of care to receive, it's very important that we actually give them the information they need to help make those decisions. So I am thrilled today to be here today with a set of grantees and partners that are doing incredible work to better understand what it is consumers want and need when it comes to the information they want, especially information about healthcare prices. They're also doing research into where consumers look for it and how health plans and states are responding to that interest. We'll be discussing promising ideas to give consumers what they want, and we'll also be exploring options for breaking down barriers for particularly vulnerable patient populations. Before I introduce our speakers, I want to emphasize that the goal of our conversation today is to provide an interactive forum for us to share ideas and for us to hear from you. And I know that we have some folks just joining and want to emphasize that there is a Q&A button towards the bottom of your screen. We will be taking questions from all of you and hope to allow at least half of the time that we have together today to respond to your questions and to really have this be a dialogue. So I encourage you to share them as they come up, and we will be able to respond in about 20 minutes or so. So we are joined today by 5 fantastic panelists who will be sharing their insights. Chris Duke, who's the director of the Center for Consumer Choice in Healthcare at the Altarum Institute, helped release our recent Right Place, Right Time report, which looked at what consumers think about health information across many different healthcare consumer segments and across different decision-making contexts. Then we'll hear from David Schleifer, who's the director of research at Public Agenda, a nonprofit organization that helps leaders and the public navigate divisive, complex issues through nonpartisan research and analysis. Public Agenda helped release a report for us called Still Searching, which came out in April and looks at how people think about healthcare price information and the barriers they face to actually using it. Doris Peters, the director of Consumer Reports Health Rating Center that many of you might have used yourselves, and she's going to offer us a patient and consumer-oriented perspective on what health plans and third-party price comparison tools are actually offering. And she'll be sharing with us some best practices for how to make that information more accessible and actually useful to average consumers. Suzanne Del Benco, who's the executive director of the Catalyst for Payment Reform, which is an independent nonprofit corporation that ranks states on how they're doing it with respect to price transparency environments, along with many other things. We'll also be sharing what states are doing to actually respond to increasing consumer demand for healthcare price information. And then finally, we'll have Amy Sheffrin, who's a program officer at the New York State Health Foundation. Amy formerly helped the GAO research healthcare price transparency and has since funded several projects on health information, including Still Searching. And she'll be able to provide the perspective of a funder in a state that is very interested in this topic. So without further ado, Chris, let's get started with you. Could you please give us an overview of the research you recently released? We'd like to hear a little bit more about Right Place, Right Time.
Yeah, so thank you, Andrea. So I'm Chris Duke with Altarum Institute, and I'll be talking about the Right Place, Right Time project today, funded by Robert Wood Johnson Foundation. So this project seeks to understand how people, and especially vulnerable people, find and use healthcare information and identify possible improvements from that. So by vulnerable, we mean a large number of different kinds of patient categories, like low income, uninsured, Medicaid beneficiaries, caregivers, and non-English speakers. We wanted to take a wide scope with how we defined information and really tried to understand the whole healthcare journey. So that means deciding if care is needed, searching for a provider, deciding on treatment, and so on. So to do this, we interviewed 65 vulnerable healthcare consumers around the nation to understand their experiences. And from this, we developed a survey. We then fielded this survey nationally to the adult population. This was both by mail and web. We received just over 4,000 responses from this. And we sampled and weighted this to the national population characteristics so we can generalize to the whole nation and not just the people we surveyed. So what did we find? We found that when we asked consumers about their satisfaction with all different aspects of healthcare information, by far, the number one source of dissatisfaction was lack of transparency around healthcare prices. Across the board, this was the number one frustration consumers had with healthcare information. The dissatisfaction rate was about 50% with transparency, which was about double the dissatisfaction rate as for other healthcare information types. So that's things like learning about a doctor's professional experience or how to manage a health condition. So we saw this was true of both low and medium income groups, but the effect was especially magnified for lower income people and uninsured patients. So building on this, we also asked patients if there's anything they could improve about the whole healthcare system, not just healthcare information, but the whole healthcare system. What would it be? And knowing prices before a visit was the number one top priority for improvement in all of healthcare. We didn't allow lowering prices as an option because that would have been the number one, but finding out prices beforehand was number one. So in the eyes of many healthcare consumers in America, this is the largest source of frustration. All right, so we understand that people are deeply unhappy with price transparency and the lack of it. But building on that, we also found that a lot of people really don't know that you can shop. So people become frustrated with this afterwards when they get a big bill they didn't expect. So when we talked to 65 vulnerable consumers around the nation, except for a few caregivers for whom healthcare had become like a full-time job, none of them had compared multiple prices. I understand it's a little bit more common with medium income people, but with lower income, this was very rare. However, although it was rare, we also saw there was a huge demand for this kind of information. When we would ask people, have you compared prices beforehand? The response we got was almost always, wait, you can do that? Show me how. Building on that, in our survey, we asked about the usefulness of new services related to healthcare information. And easy comparisons online of healthcare prices and quality was listed as one of the most useful new services possible. So we think that although people are not necessarily asking a lot, there's a lot of demand for this information. So as I see it, we really have two barriers that we're working with. One is that prices are hard to find, and the other is that people don't necessarily know you can ask. And that makes demand seem lower than it really is. So that's just a brief summary about our report, but the whole thing is online and the data set too. It's at altarum.org/rightplacerighttime.
Thanks so much, Chris. And just for the benefit of folks who are listening, we'll be sending a reply email at the close of the webinar with links to all of the research that we're referencing today. And I also saw a question pop up asking if there are slides. We are not using slides. Well, we might have a couple of slides later to emphasize points, but we are planning to just use this as an opportunity to have a dialogue with one another. So Chris, apart from, I think, the surprise of finding that cost and price frustrations were number one, I'm wondering if you could share any other surprises that really were interesting to your team as you conducted this research.
Sure. So as a healthcare researcher, I have to admit I was not too surprised that frustration over price transparency was number one. I think people kind of acknowledged that. But what did surprise us was that many interviewees told us that when providers don't account for prices, they see that as a kind of personal disrespect. And that can go on to sour the entire patient-provider relationship. Many patients told us stories about a provider that recommended a treatment that was unnecessarily expensive, and that caused them to have financial hardship, and they stopped seeing that provider. They took it as an act of hostility. So for example, a prescription for a brand name drug only may cost hundreds more than a generic. And a few $100 may not matter as much to a physician, but for many of the patients, that's their rent or their groceries. And so facing them with that financial hardship is not really looking out for the patient well-being, and the patients certainly don't see it that way. Now, in the past, doctors were really trained to avoid thinking about costs. It was seen as best practice to make sure that issues of cost didn't enter into treatment recommendations. But now that as consumers are paying more, we're starting to see that many see it in the opposite way. Considering price may help consumers receive the best care because they're not going to be able to pay for the more expensive treatment option. I know doctors don't always have the availability to see this, but I think patients are tired of hearing that.
That's really, really interesting, and a great segue to David. So I know that seeing the frustration around not being able to access price and cost is something we were very interested in digging much more deeply into. So I'm hoping you might be able to share with us some of the major findings and insights from your Still Searching report.
Sure. So as Andrea said, Public Agenda conducted this research with support from RWJF and from Amy at the New York State Health Foundation. And we set out to explore how Americans in general are trying to find and use healthcare price information. We also, in addition to fielding the survey nationally, we fielded the survey in 4 selected states, which were New York, New Hampshire, Florida, and Texas. So today I'm going to talk mostly about the national findings. Maybe some of the states will come up in some of the questions. All the research is on Public Agenda's website. If you just search Public Agenda Still Searching, you'll find it. So I think, the kind of the big headline is that we found that half of Americans have at some point tried to find price information before getting care. So that means they tried to find out how much it would cost in advance to see a primary care doctor, specialist, for a hospital stay, for a medical test, not including the copay. We specifically excluded that. It also includes anyone who ever tried to find out how much their insurance company would be paying a doctor or hospital. And actually quite a few people have done that. So it's about half of Americans have tried to do this. And among the half who haven't, about half of them said they would like to know the price of medical services in advance. And overall, about 2/3 of Americans say that there's not enough information about how much medical services cost. So, I mean, I think you're probably, when you imagine what it looks like to look for price information, you may be thinking it means looking online. But as I think, Chris alluded to, this is part of what happens in an interaction between a doctor and a patient. Our survey shows that people turn to a broad range of sources for price information, including calling their insurance company, asking, and using their insurer's websites, also asking friends and family, not the most reliable source, but they're trying, asking doctors, asking receptionists. Looking for price information, we found, does not mean comparing prices for everyone. It doesn't mean shopping around. So we found that there's about 1 in 5 Americans who's compared prices across multiple providers, and about 1/3 said they had just checked a price from one provider when they were before getting care. So those folks they just want to know, what's it going to cost me. They're not shoppers. But people who compared prices, it seems like it can pay off to some extent. So a little more than half of people who compared prices say that they saved money, and that's actually higher in the states we surveyed. Even higher proportions of comparers are saying they save money. So I think over the years, maybe not so much recently, but there's been this concern that making prices more transparent could actually somehow lead people to choose higher priced care, based on the assumption that people think price is a sign of quality. The research that RWJF funded that we did 2 years ago showed, and this research confirms, that most people do not think higher price care is higher quality, and most people don't think lower price care is lower quality. However, and I think one of the barriers here is that a surprising number of people don't know that doctors' prices can vary and don't know that hospitals' prices can vary. I think this is probably hard for healthcare experts to even fathom, but just under half of Americans are aware that hospital prices vary, and same for doctors. So there's really an opportunity there to build awareness. I do have time to touch on two other findings quickly. Nationally and in the states that we surveyed, very large majorities of people, I think it's 80% nationally, say it's important for their state government to provide price information. And I think that's really, people are really seeing a role for states here. The other thing is, and I don't want to reduce price information to just websites, but some states do have price information websites, including New Hampshire and Florida. About 18% of people in New Hampshire and 23% in Florida said they had heard of their state's websites by name. And that's higher than had heard of any of the third-party websites we asked about. But when I showed, we did a focus group in New Hampshire, I showed those folks their state's website, and I said, that New Hampshire was one of the few states to get an A from CPR for on their price transparency scorecard. One of the men in the group said, well, we get an A for having the information out there, but we get an F for getting the word out that the information is available. So I think that kind of, that's the challenge that I think we're all kind of facing here. So I'll wrap up, but again, you can find a report on Public Agenda's website, publicagenda.org. It's called Still Searching. It's right on our homepage. And there are also separate briefs on the 4 states where we did this research. Yeah, thanks.
Great. Thank you, David. And once again, we will be sending a follow-up email with links to all of the research we mentioned. I'm glad that you brought up the quote from New Hampshire. That's one of my favorite takeaways from your research. And I wonder, you mentioned that that the report oversampled in 4 different states. So could you share maybe 1 or 2 high-level findings about how things varied between the states that you looked at?
Yeah. So I think that, what we saw in the states were really differences in degree rather than differences in overall patterns. So the patterns are very similar. So, half of Americans have tried to find price information, half of people in New York State also, and somewhat higher percentages in Florida, New Hampshire, and Texas. And again, it was about little more than half of people nationally who compared prices saved money. And that was even higher in the states we surveyed. Up to 69% of Texans who'd compared prices said they saved money. The other thing, interestingly, New Hampshire, is, I think, pretty advanced in a lot of ways in terms of their price information or what's available. 76% of people in New Hampshire say there's not enough information available about how much medical services cost. That was actually the highest of any of the states where we did this research.
Interesting. So definitely not something you'd expect.
Yeah.
And looking forward to digging into the state angle in a bit with Suzanne. But first, I'd like to turn it over to Doris. So I know at Consumer Reports, you've been looking closely at what this actually means for people and consumers, so taking it down from the conceptual level. Can you share a bit about what you've seen and what you've heard and how Consumer Reports is responding to this issue?
Definitely, thank you. Yeah, I did want to bring up the impact on individuals, first of all, because there's a lot of talk about what people are looking for, but really the impact on what happens when you can't afford your medications. Your prices go up on medications. We spent a lot of time actually surveying and talking to people about their drug costs, and the kind of, both in surveys, but also in qualitative research, one-on-one discussions, the emotional impact, first of all, and then just the practical impact of price increases and then not being able to afford your drugs, having to skip them, having to, quit your job so that you can get better insurance to cover your medications. And it's just a huge, huge emotional thing to listen to and to think about how, how these solutions are going to help individuals really get better health outcomes. So I just wanted to bring up that point. Also, just to react to Chris's point that he brought up about how people feel about talking about costs, or that costs should be available. We did, in some qualitative research, find a subset of people very uncomfortable with the cost discussion, and these were also individuals that were lower income, and they really had this feeling that it would cheapen the relationship, and that that the provider, it would become like a used car salesman. So we think a lot about how to address that population and move them to a place where they feel comfortable. So I just wanted to bring those up. And I was going to just talk briefly about some research we've done on cost estimator tools that we have done with support from the New York State Health Foundation. And we've done both qualitative and quantitative work in watching people using these tools and getting feedback from them, and also objectively scoring the tools for their attributes, and using survey data from consumers about what attributes are important to them. And some of the comments I'm making are also a little bit larger from a lot of the research we've done. And one thing I want to emphasize is to don't underestimate your audience. There's a lot of talk, and I battle internally here too, about, well, make it really simple and make it take away more, just too much data, it's too much information. And as long as what you're showing people is relevant to their situation, they want more data. They want more and more and more, as long as they're out there actually, looking for it. If you throw data at someone who's looking for car information, and you throw them information about drugs, that obviously doesn't work. But people really want more, so don't be afraid. And consumers, just to echo what Chris said, they're very hungry for this information. But don't also buy the mantra that they're too sophisticated and you need to give them some, amazing experience and everything. People are so hungry for it. They have low expectations, believe it or not. Even though you think they have high expectations, they really have low expectations. That doesn't mean we should lowball what we give them, but it means that whatever we can do now is going to help people, and we'll just keep improving it. And people really want to engage with this data. So I'll go a little bit over some of our specific findings with some of the tools that we had. Just underscoring the issue about consumers being interested in these tools. We had people be interviewed using health insurance plan tools as well as public tools. Of the health insurance plan tools, 78% of the people that we interviewed said they would recommend their tool to other people. So it just shows you that they're really into it. Some of the issues, though, are, of course, just general. People are excited by the promise of these tools, but they're frustrated by some of the gaps, especially the lack of quality information. There's a lot of talk about price, but there's actually less usable quality information than there is price information, so I didn't want to forget that. Also, the separation of quality and cost information makes for a really lousy user experience. They have to go to 5 different places and put it all together themselves. So that goes to some of the low-hanging fruit. I'm going to just show you a couple of examples of the data that we have here. This is kind of it's got a lot of data, but I'm sure you can handle it. A number of plans that we looked at, some are national, some are in New York State, and it shows you their overall scores for their cost and quality tools that we assessed. And you can see, just like in healthcare quality, the quality of these tools also varies from a score of 38 out of 100 all the way to 84 out of 100. And you can see in some of the categories where you see green, the performance is pretty good, but then as you go to the right, the performance starts to drift off, especially in what I mentioned before, showing cost and quality together in a way that promotes the idea of value. So that's where a lot of the tools fell short, with the exception of the Sigma tool. So I would say that's the biggest gap in these tools. So as far as recommendations for the improvement of the tools, the low-hanging fruit for usability, integrating different pieces of the tools together is really important because things are spread out all over the place. And some of the third-party vendors that these insurers use are not so great, and that's contributing to some of the lower scores. And I'll just briefly also let you know that we looked at public tools as well. And you can see they perform a little bit less well than some of the private tools, but they have less data. So some of the state-based tools were already mentioned, CompareMaine and New Hampshire health costs. And so our full report that you can see at consumerreports.org will go into these tools as well. And then my final points will just be that, you know, millions of consumers don't have access to some of these health plan level tools, and that the private tools should not throw people over to public tools that are not as useful to them. So we want the insurers to have better tools. And really the main barrier to the effective use of these is consumer awareness. So I think plans should try to address that by working together with other groups to raise awareness. So again, more of the data can be found on consumerreports.org. Thank you.
Great. Thank you very much. So you just mentioned that a big issue related to use of these tools is lack of consumer awareness, and I think that that's a thread that we've seen across a number of our research studies. I'm curious if you could reflect on any additional contributors you see at Consumer Reports to the disconnect between the dimensions and the level of information people want and what's actually being made available to them.
I'm sorry, do you mean in terms of the awareness of it or the gaps between the need and the data?
The interest in the specific type of data and specific type of information and what these tools are currently able to offer.
Okay, definitely. Yeah, I mean, there's consumers are interested in some of what's available there. I think that we see that there's not especially on the quality side, there isn't enough outcome data. Consumers will see some sort of center of excellence type of thing, and they will be frustrated by that and wonder why should they be looking at that and not trust it. I think so having useful, actionable quality information together with the cost information that's personalized, I mean, it's kind of a no-brainer what you think they would want. So I think it's the common gaps that we know about in quality measurement that, and consumers identify it without you asking. So it's what they need.
Yeah, that makes a lot of sense. Thank you so much.
Thank you.
So now I'd like to turn it over to Suzanne to close us out before the Q&A session. I'd love if you could provide an overview of what states are doing. We heard from David that 80% of people think their state government should be providing them with price information. So what are states doing to help people compare prices or access prices?
Well, it's an important question, and I'm just going to give a little bit of context here, which is that Catalyst for Payment Reform, the organization I work with, works on behalf of employers and state Medicaid and employee retiree agencies who want to get better value for their healthcare spending. And they think about how we pay healthcare providers, but they also think about innovative benefit designs and provider network designs and trying to help consumers gain access to high value providers who are going to give them good quality for a good price. And when they started tinkering around with benefit designs, they realized they couldn't put them in place without price information being available to people. And so, back 7 years ago now, we started advocating for greater price transparency and started by pressuring the health insurance plans. And then a whole field of entrepreneurs cropped up that employers direct contract with to provide this information to people. And then the question really remained, and several people have raised this, well, what happens to people who don't happen to work for a big employer or who don't have insurance coverage through a big insurance company that's invested in making one of these cost estimator tools available to people? What information can they gain access to? And so we became interested in what states were doing to ensure that all citizens have access to price information. There's also a sidebar here, which is that we care about people getting information that they need to make smart decisions for themselves, but also we think that the opacity in healthcare around price, and frankly, quality to some degree too, even though we've been working on transparency and quality for even longer, has a bad impact on the healthcare marketplace. Not that necessarily we want to make every price available to everyone because you don't want healthcare providers to collude with each other or things like that, but by not showing people how there is variation and not holding the marketplace accountable for proving why one provider should be higher priced than another, we're really hurting the value of our healthcare dollar. So with all that as background, we have for several years now partnered with the Healthcare Incentives Improvement Institute, HCI3, which is now actually part of Altarum Institute, to put out a report card on state price transparency laws. And I love the research that we've heard today because it really does make me feel like it's important that we continue doing this because we know that Americans really want access to this information and think there's a role for states to play. So the latest report card, we found that there are only 7 states at this point that have absolutely no laws in place addressing the need for price information for consumers. So most states have something in place. However, 37 states do have something on the books but they fall far short of getting information to consumers that they can actually use. So it's a nice nod to the need for healthcare price information, but far from actually implementing anything that is useful by consumers. So some states, and this is the latest trend, have put laws in place where they want to require either health insurance plans or healthcare providers to give price information upon request. And it's kind of, floors me when you think about it, that you have to put a law in place that says they got to do this, because you would think, they're selling a service, a procedure, some kind of care, and the fact that you need to put laws in place that make them provide this information is kind of shocking. But that has been the latest trend, and I think because it's the easiest thing to do. A state doesn't really need to get involved. They just require the other parties to provide the information upon request. The challenge with that is that if you have to make 20 phone calls to find out what something's going to cost you so that you can comparison shop, and I will tell you, having tried to do this myself, most of the time you're going to get somebody who does not know how to provide the answer to you. It's a lot of onus on the consumer. So there are 6 states that really stand out because they have gone further. They have not only made sure that the price information that they're making available comes from a rich source of data, something called an all-payer claims database, where there's information gathered by multiple payers, and therefore you can get more accurate estimates of what the total cost of care might be from one provider to another. You can also gauge quality a little bit better when different payers pool data, because at least the amount of quality you can judge from transactions that have occurred with providers, then you get better sample size and you can say more robustly how our provider is performing. So 6 states really stand out because of their rich data sources. Also because they have tried to make the price information meaningful to the individual consumer. Some of the websites that states have put up actually allow people to customize the information to their own insurance coverage that they have, if they are insured, or identify for someone who doesn't have insurance what it would cost them. Scope is also important. A lot of projects start small, so they might start with just outpatient clinic prices or prices for key surgeries. But at the end of the day, when consumers are looking for healthcare services, there's a wide array, and so we need to have information on a variety of providers and on a variety of services. So the states that really stand out have achieved a good scope and also have made sure that information is available on a public website. And I couldn't agree more that just because you put information out there doesn't mean that someone knows it's there or that they know how to use it. We need to have a campaign to draw people's attention to this information, just like we do to get them to buy different retail products. We also, need to make sure that they have other motivators in using the information. Sometimes people are personally motivated, either because they can't afford something expensive or because they've heard about bad experiences and they're afraid. They want to make sure they make a good choice. But if people start with the assumption that all care is created equal or all care costs the same, they're not going to be super motivated to look at the information. So some of the innovative things that our members are doing, big employers and states, where they're trying to create benefit designs that really create less cost sharing. If someone makes a good choice and goes to a high value provider, then they start getting interested in looking for which providers are going to meet that criterion. So just a couple examples, I would commend people to look at Colorado's efforts. They have data from an all-payer claims database. They have a very full scope of providers and the actual amounts that providers get paid as opposed to what the providers want to charge. And they really have an excellent website for consumers. Oregon is another example. They're off to a great start. They do need to work on expanding the scope of services they have and add in physicians, not just hospitals. But again, there are 6 states really worth looking at. And if you go to our website, catalyze.org, and look at our research section, you can see the latest report card. And it sounds like Andrea is going to be sending out a link anyway.
Yes, thank you. And just a quick follow-up question. Where do you see, in the next couple of years, given that you do work with state Medicaid programs and states in general, what are some of the trends you're seeing in terms of what states are hoping to do with respect to making this information more meaningful and accessible?
Meaningful and accessible. I think the trends we're seeing are really around these requirements of plans and providers making information available upon request. So the hard work really lies in developing a robust all-payer claims database where by pooling data together, we can really give consumers more accurate estimates of what they'll end up paying by getting care from a certain provider and what the quality looks like. There are only so many states with these in place, although more and more, and there are a lot of restrictions based on state laws around how these get used that vary state to state. So I would say the trends are unfortunately not in the greatest direction, but there are still some states working very hard to do a very good job by their citizens, and we hope to see more of that in the future.
Gotcha. Thank you. And as this is a live webinar, we make mistakes, and I was so excited to get to questions. I inadvertently said Suzanne was closing us out, but we are also going to hear from my colleague Amy Sheffrin. I would love if you could share your thoughts as a fellow funder and one that works within a specific state. Where do you see the future of health information going, and what do you think are directions that the field might move in that would be particularly highly impactful to residents of states like New York?
Well, I'd love to, at the New York State Health Foundation, we've made various investments to bring price transparency to New York, and we ourselves are still grappling with its limits and its potential. We know the data is still in flux as to whether it's effective. We don't know yet. Are the impacts at the consumer level, the market level? How do we move that needle? We see today from the research from Public Agenda and Altarum that the public is seeking this information. They're looking for it everywhere, from receptionists to the websites. There's a real appetite. But we also know from other research, such as RWJF's Moving Market study of the New Hampshire Healthcare Price Transparency Tool a few years ago, that price transparency can also have market effects, that it led to kind of high-priced outlier hospitals looking to reopen their contracts with insurance companies so that they could lower their rates once the sunlight was on them. So there were some market effects that we see, but we see limits continually at the consumer level. There was that MBER study in 2015 where a company switched all its employees to a high deductible plan, fully funded the cost of the deductible on HSA, and then gave all of its employees access to this third-party health price transparency tool, Castlight. And we saw from that research that in this kind of natural experiment that healthcare spending declined, but mostly due to foregoing care rather than people saving money from shopping around. In fact, few of them were using the price transparency tool. Despite this, I'm still a believer. We saw from the Public Agenda survey that a large, maybe a majority of respondents, maybe about half of the respondents of Public Agenda, did not even know that doctors' prices vary, that doctors charge different prices for the same service. So I really believe that greater price transparency, more tools can really help pierce that veil. It can build awareness among the public that prices vary. And that's a powerful message because Americans share this basic sense of fairness and they don't want prices to vary so much. It also builds on key messages that we want consumers to know, that not all providers are the same, that quality varies, and that where you go for your care matters.
Yeah, that makes a lot of sense. And what would you say are maybe one or two of the biggest unanswered questions that you see around the limits or potential of making healthcare prices more transparent?
I'm not sure if it's an unanswered question, but I think in terms of future direction, I think what Suzanne laid out about the potential for all-payer claims databases, there's real potential there. We're really trying to push for the all-payer claims database that will be developed in New York to offer some kind of price transparency. But, these sort of endeavors are really challenging. We saw from the Public Agenda survey that 80% of the public supports the states to offer some sort of price transparency tool. There's rarely that kind of bipartisan clamor for a government intervention. So 80%, that seems like something we should be paying attention to. But all-payer claims databases they're facing a lot of barriers. The task is very complex. it's a difficult job to do. The states, I think, aren't necessarily sold that the investment will be worth the actual usage, because usage has been low. And, there's a lot of people that say, well, the numbers aren't perfect. It can be imprecise. It may not give a consumer the kind of out-of-pocket cost information that a health plan can. But I think the biggest factor and the biggest challenge is really the political pressures that are really slowing it down. And that's why, Suzanne said, there's only 6 states that are out there that are really doing it. Price transparency is politically charged. It is, APCDs use real prices. They use the real prices that insurers pay providers. And insurers would like to claim, and maybe providers too, that this is proprietary, that it's a trade secret. But you look at the Public Agenda survey, and Public Agenda found that 2/3 of Americans believe that insurers should be required to publicly post their prices. And in a state like New Hampshire that has an APCD, it was 77%. So there's a real consumer support for it, but the politics of it are challenging.
Great. Yeah, well, I think we are scratching at the surface of a very thorny discussion. So thank you to everyone for your brief overviews of the very rich work that you are all doing. We're now going to transition into audience Q&A. So for those of you who haven't started typing in questions, and we have a few things that have popped up already so far, please go ahead and click on the Q&A button, type in the question that you have. If you'd prefer to use Twitter, we are watching the hashtag price transparency, so it's completely fine for you to ask your question there. After the webinar, you can continue to use that hashtag to ask questions. We'll monitor, and I'm happy to respond myself and to ping some folks to get you an answer as well. So on the topic of APCDs, one of our all-payer claims databases, one of the questions that came in, I will read, is many states are working to make these data available. Thank you for acknowledging the value of APCDs. But as we know, there's a great deal of industry resistance, which affects funding and even the enactment of price transparency laws. So there's a question to the group about how consumer advocacy organizations can take on sort of a more prominent role in extolling the value of APCDs and their ability to actually provide consumers with the information they want and need.
Hi, this is Doris. I'll just sort of speak from the perspective of groups that we use that data and then we'll can present it to consumers. I think the more that we can show the consumers using the tool or the value of those tools in the states that have them. I mean, we did this assessment now and showed the high quality of the tools from New Hampshire and Colorado. The more that, the better, and the more the data is actually used in whatever way it can be, promotes the further interest in it. So I would say it's getting together to try to make the data sets more usable to other parties, because then I think there'll be a more organic pickup of the information.
Great. That makes a lot of sense. So another question that we got, and we talked a bit, David, about awareness of different types of specific price transparency platforms. But one of the questions we got was, what do you think about vendors like Castlight and Change Healthcare and similar companies that access healthcare claims data and use platforms to highlight price variation for the general public? What are we seeing in terms of the utility of those platforms, the awareness of them, et cetera?
Well, so the thing that we saw was that awareness of those platforms was lower than awareness of states' websites in the states that have websites. So there's about 17 states that we identified as having some kind of state price information website. Obviously, some of these are quite limited. And at least, from what we could see, the name recognition of those was higher than Castlight or some of those other sites. I mean, I think the issue with Castlight is that it's great if your employer purchases access for you to Castlight, and we know that that's not true for a lot of people. So I think that and I guess the other thing that I would say is that and this it partly comes out of the focus group research that accompanied the survey, is that a lot of people sound like they want to talk to a human being. They want to talk to, it's either the insurance customer service rep, or it's the receptionist in the office, or often both. They want to know, like, where am I in my deductible, and like, are you sure this is the right number? And this is they just want that human touch. And so I think I think we have to recognize that that's what a lot of people are looking for, and then think about ways that we can make sure that those folks have, that people have all the information that they need, that patients are coming and asking them about.
Great, thank you. There's another interesting question here that I want to respond to very briefly, and then turn it over to Suzanne for her thoughts. So the question is, what do policy experts think about all-payer claims databases versus bundled payments? Is one initiative better than the other? And my personal reaction to that would be that they are two attempts to solve related but different problems. So all-payer claims databases, while they can provide information about claims, which are proxies for charges and prices, and sometimes provide actual pricing information, that is a way to provide the market with a sense of variation in pricing. It can provide consumers with a sense of variation in pricing, and help, as Amy referred to, establish sort of a sense of what's fair and what isn't. And that might help plans decide who they want to contract with, or help them think about what a realistic sort of reimbursement rate is. But bundled payments, which are a payment reform vehicle, are really sort of designed to help improve the quality of care while reducing unnecessary cost variations. So that might be a tool that, because of the way that reimbursement is flowing to particular providers, right? They're getting one bundled payment for a specific either episode of care or condition, right? That might encourage them to coordinate care better, to make sure that care transitions happen more effectively. That might also help them or inspire, I should say, providers to think about specialists that they're referring their patients to that might be more cost efficient or cost aware. But that's a very interesting question. So Suzanne, curious if you have any additional thoughts there.
Yeah, I mean, we could spend an hour talking about the interrelationship between bundled payment and all-payer claims database. It's not, sort of, at first glance, there's not a tight relationship. As you point out, bundled payment is a way of paying healthcare providers that is meant to improve the quality and potentially the efficiency and affordability of care. All-payer claims databases are efforts to pool data together to get better insight into the quality of care and the costs associated with different providers. However, what I would say is, in designing a bundled payment program, one must have very robust insight into what is happening in a provider's practice around a specific episode of care. And if you only look at data from one payer's perspective, you might have an orthopedist who contracts with 10 different health plans. And so, one might give you the sense that they're very affordable and have great quality, although you may not have enough cases to be able to really judge the quality. Another might give you a different picture because they've negotiated something else. And so by pooling all that information together, it can highlight where care is going well, where there might be potentially avoidable complications happening. And while a provider, for example, might price its bundle in a very advantageous way to a given payer, if they make lots of mistakes and there has to be a lot of follow-up care, the overall cost to the patient in terms of suffering, as well as the total cost of care for things that might not be included in the bundle but have to be taken care of later because of errors, that gives you a better complete picture. So they can be very robust sources of data to put a program in place that's well designed.
Great, thank you. And another great question. So I think this could be of interest for Doris to respond to, or any of you really, but the question was, why would consumers who only pay their copay care about the total cost of a service or the reimbursement that a provider receives?
Hi, yeah, I think in some cases copays can even be extremely high. So we've talked to people who have said they will limit the number of visits that they have because they can't afford the multiple copays, especially if you have a chronic condition, something that requires multiple visits. So as copays go up, I think there's a lot of sensitivity. I mean, even just a $10 difference in something people pay makes them price sensitive. So I wouldn't underestimate the copay part of it. Other than that, we did interview people who said that they were not challenged. Some of them were not challenged by costs because they had good coverage. They had some of them. One person even had zero copays, but they were very curious to see the information, and it made them overall aware of the variation. So I think it's still part of educating consumers that there is variation. Plus, it goes into the value equation of cost and quality. So I think it's an issue all along, and plus everybody's going to be paying more and possibly shifting onto, plans that have higher deductibles. So it's something that's probably that more of us will have to face.
Can I add to that? I would also say that, we're setting consumers up for failure if we don't do it at all. We know the last decade has seen an influx in high deductible health plans, and these have been put in the market before the market has really provided price transparency for consumers. So while, there's the data is still in flux, and there are critics that say, well, for the majority of people who are commercially insured, they're not price sensitive enough. Well, let's be real. Are we being fair to consumers to be putting these sort of products in the market without price transparency?
Yeah, I think that is a very fair point. So I'm going to call on two more questions, and the last one will be a reflection question, I think probably for many of us. But on the idea of information transparency in general, we heard Doris talk about the importance of not divorcing quality from cost information. And I'd love, Chris, if you could share a little bit more about the markers of quality or indicators about particular providers or facilities that you saw in your research that people actually want when it comes to helping them make a decision about who to see or whether to receive care.
Sure. So if I understand correctly, you're asking about where do people look for quality in providers and what are they looking for?
What are they, specifically what are they looking for?
So most commonly we found that people are going online, looking at patient reviews and asking friends and family. Although there are a lot of resources out there that do these things more systematically, like Hospital Compare or other sources, people by and large aren't using those as much, largely because they don't know about them. As far as what they're looking for, we found that one of the top considerations was sensibility to the patient's overall well-being, rather than just being treated as a single condition. And a part of that sensitivity to overall well-being is considering the financial impact of the recommendations for treatment. Other things were sensitivity towards shared decision-making. That was a big one. And of course, price is a part of that as well.
Great, thank you. And we had an audience question that I think is a perfect one to help wrap this up. So we've talked about price transparency. We've talked a bit about quality transparency. We've talked about the rise of high deductible plans and efforts in states to make information more transparent. The question we received is, why invest in health information transparency at a time when the landscape is so volatile and unknown? I would argue that that is the perfect reason to make the investments in information transparency, but I'd love it if we could just go around the panelists and reflect on this question a bit. And Amy, I'll start with you. I'll start with the reverse order of how we began the presentation.
Is anything else going on in healthcare? I did not know. Yeah, that's a great point. I think the way that the political landscape is that we should invest in efforts that will empower consumers. So we really have to focus on where those opportunities are, and price transparency is one of those opportunities.
Great, Suzanne.
Thank you for the opportunity to comment on this. You know, while there might be chaos in policy land, those who purchase healthcare in the commercial sector keep having to figure out how to get better value for their healthcare dollar and to guide consumers. So there's no stopping in this area. And we think of price transparency and quality transparency as a fundamental building block to a higher value healthcare system that's going to support all the kinds of innovations we're experimenting with. So it just has to continue to be laid in a stronger and stronger fashion.
Great. Doris, what are your thoughts?
Well, sort of similar to Suzanne in that high healthcare costs impact everybody. And so if we're spending more on healthcare either as an employer, then that's less money that's going towards salary. If we're spending more as a country or a state, that's less money we can spend on schools and other things. So if we don't have price transparency and quality transparency, we're going to have a harder time, you know, getting better value and driving healthcare costs down while retaining quality.
Great. David.
Yeah, I mean, I think that at the individual level, you know, whatever's going on with policy, you know, we know that the overall trend has been towards more cost sharing, more people with HSAs and higher deductibles. And, you know, I think we all need to be clear-eyed about the limits of price transparency, but I also think it just doesn't seem fair to give people those responsibilities and not give them at least a fighting chance of finding out what their care is going to cost them. And then I think to Doris's point, I mean, the price transparency itself isn't I don't think is the end game here. I think, you know, what we're really talking about is how to get costs under control, you know, in a bigger sense, so that we can spend money on the things that we want, like schools and bridges and parks and all those kinds of nice things, because, you know, that's, you know, the money there's money that's not going there, that's going to healthcare. And I think that we could be doing better.
And Chris?
All right, well, thank you everyone for saying it so well. I would say that more volatility is a reason for more information and more transparency, not less. Any policy changes in the near future are likely to shift more of a burden on consumers, which we need to give them more of the tools to allow them to make smart choices. And finally, as David mentioned, the ultimate end game is not only that consumers save money, but that market forces can work as they're supposed to drive down healthcare costs so they're not 1/5 of GDP.
Yeah, that is well said. And I would argue, just from the perspective of wanting to support the creation of a community and environment that is centered around people and families and allowing individuals to live the healthiest life they possibly can, if we don't give people information that they actually need to make choices, we're really not servicing them very well at all. So thank you so much to our stellar panel of experts and reactors. I hope that everyone who participated enjoyed the conversation. Please continue this conversation with us using #PriceTransparency on Twitter. I think we are all pretty easy to get in contact with if you have burning questions following this discussion. And we look forward to sending you links to all of the research we mentioned today. And thank you so very much, and enjoy the rest of your week.
Thanks, Andrea.
Thank you.
Thank you.